Hi there, health-conscious friends. Do you ever feel like you need to pee all the time? Do you wake up multiple times a night to go to the bathroom? Or maybe you sometimes don't make it in time and experience bladder leakage. If so, you're not alone. Overactive bladder and urinary incontinence affect millions of people, and it can be frustrating and embarrassing. But what if I told you there was a simple, inexpensive supplement that could dramatically improve your bladder health? I'm talking about vitamin D. Now I know what you're thinking. How could a vitamin actually help with bladder problems? Well, stay tuned, because in this video, I'm going to walk you through the science and help you understand exactly how vitamin D impacts the bladder. First, let's do a quick review of how the bladder works. Your bladder is a muscular organ that stores urine produced by the kidneys. As the bladder fills, receptors send signals to the brain, so you become aware that you need to pee. When you're ready, the brain sends signals to relax the sphincter muscles and contract the bladder to release the urine. This process is controlled by the nervous system and smooth muscle in the bladder wall. Vitamin D receptors are found throughout the body, including in bladder muscles and nerves. So how does vitamin D help? First, studies show vitamin D may help prevent urinary tract infections. These painful infections cause bladder inflammation, urgency, and frequency. By boosting immune function, vitamin D helps prevent the infection in the first place. Second, vitamin D may strengthen the bladder wall itself. The bladder wall contains layers of cells sealed together by tight junction proteins, like occludin and claudin. Higher vitamin D levels increase production of these proteins, keeping urine from leaking between cells. Third, vitamin D may reduce overactivity and instability in the bladder muscles. By interacting with vitamin D receptors, bladder muscles can contract and relax normally. This makes you less likely to experience sudden urges or leakage. Fourth, vitamin D supports nerve function. Healthy nerves are key for proper bladder control and sensation. Vitamin D deficiencies are linked with nerve problems, while optimal vitamin D prevents damage. The research backing these benefits is robust. In a 2021 meta-analysis, researchers found that 6 out of 7 studies linked low vitamin D to worse urinary incontinence and overactive bladder. 2 other studies found vitamin D supplementation improved symptoms. A 2020 study of older men found that high-dose daily vitamin D reduced overactive bladder symptoms compared to a placebo. Multiple trials confirm that vitamin D strengthens the bladder lining and tight junction proteins that prevent bacterial invasion. Population studies consistently associate low vitamin D levels with more frequent urinary tract infections. So checking your vitamin D status is an important first step. A blood test can reveal if you're low, normal, or optimal. Deficiency is very common, especially in colder, darker climates and during winter months. The recommended daily vitamin D intake is 600 to 800 IU. But studies show you need higher levels, at least 2,000 IU per day, for bladder benefits. Always consult your doctor before supplementing. The best food sources are fatty fish like salmon and mackerel. Also aim to get 10 to 15 minutes of direct sunlight most days, since our skin produces vitamin D from sun exposure. Just don't overdo it, as too much sun can cause burns or skin damage. You can also take an over-the-counter vitamin D supplement, but speak with your doctor about the right dosage for you. As you can see, vitamin D is kind of a big deal when it comes to bladder health. So how can you know if you would benefit from more vitamin D? Be on the lookout for the following signs of insufficiency: frequent or recurrent UTIs, sudden urges to urinate, needing to pee often and producing little urine, waking up multiple times at night to pee, leaking urine involuntarily, weak urine stream or trouble fully emptying, constipation. Checking a blood test for 25-hydroxyvitamin D is the best way to test your levels. Anything under 30 nanograms per milliliter is considered deficient. Ideally, you want to be in the range of 40 to 60 nanograms per milliliter for bladder benefits. Risk factors for low vitamin D include limited sun exposure, darker skin tone, being elderly, living in northern latitudes, winter months, obesity, certain medications, malabsorption disorders. Now, vitamin D alone may not resolve all bladder problems. Things like UTIs, enlarged prostate, cysts, or nerve damage require additional treatment. But optimizing your vitamin D levels can dramatically improve symptoms, prevent infections, and support bladder health. Some other tips to keep your bladder happy include: stay well hydrated to dilute urine and avoid irritating the bladder wall. But don't overdo it before bed. Reduce bladder irritants like caffeine, carbonation, alcohol, and spicy foods. Eat cranberries to help prevent UTIs or take D-mannose supplements. Maintain a healthy weight to avoid extra pressure on the bladder. Practice Kegels and pelvic floor exercises to strengthen muscles. Use the bathroom as soon as you feel the urge to avoid holding it. Treat chronic constipation, which can strain the pelvic floor. Avoid smoking, which increases coughing and leakage risk. Take warm baths to soothe bladder muscle spasms and pain. So be sure to incorporate some of these tips, along with optimizing your vitamin D levels through smart sun exposure, foods, and supplementation. Give it some time, and you should start to see some relief from your bothersome bladder symptoms. For a common, affordable supplement, it packs a big punch. So raise your D. Your bladder will thank you. Now I want to hear from you. Do you take vitamin D supplements currently? If so, have you noticed any benefits related to urinary or bladder health? Have you ever had your vitamin D levels tested? What were the results? Do you make an effort to get regular sunlight exposure? How do you think this impacts your health? Share your thoughts in the comments below. I love hearing your experiences. See you next time.